Hello everyone and welcome to this new lecture. As you can see here, we have the principle of oral diagnosis. First of all, we have to know who is the patient that we are treating before even knowing what is his or her problems. And this is a main principle. It's not to focus on the problem, but who is the patient, what does he want, and what is his personality, and knowing the patient, introducing the treatment plan and introducing the patient to a successful way that he can obtain so that he will be ultimately satisfied with the result. And this only will happen after knowing the patient more than knowing the problem that he faces. Here we can see some definitions about the health. That is a physical, mental well-being, and not merely an absence of a disease. So if somebody is absent, if somebody has no disease, that doesn't mean he is healthy. He has to be physically, mentally, and socially well for him to be called a healthy individual. Next, as we can see here, the healthcare provider or the healthcare in general. Healthcare is the diagnosis, treatment, prevention of the disease, illness, and injury, and other physical problems are also important to be treated. Mental impairment in a human being is also important. Physical diagnosis and treatments, and to prevent these complications. The healthcare provider is the person or the individual that provides the prevention, the curative method, and the rehabilitative health promotion. He provides this systemically for an individual or families or communities. This one is the healthcare provider. What is now the definition of oral medicine? Oral medicine is a specialty of dentistry that is concerned with non-surgical management. Therefore, we don't use any surgery with oral medicine, only giving medications, and in hope of treating the patient, we only give the patient medicine. We do not do surgery. In order to manage the non-dental diseases that affect the oral cavity and maxillofacial region, with doing oral diagnosis and health care of a medically compromised patients. So in general, in oral medicine, we do not perform surgery and we do not care about the dental region, only the oral region in general. This is oral medicine. When it comes to oral diagnosis, that is generally defined as the determination of the cause of oral and maxillofacial diseases by the combined use of the patient history, physical examination, and adjunctive diagnostic procedures. Moving on to the diagnostic methods. First, we do a collection of the information, whether it is subjective, like patient history, or objective, like the physical examination or physical history. Then an adjunctive diagnostic procedure is also important. Next, we do evaluation of this collection of information by watching if there is any dental abnormality, pulpal or periodontal, and even non-dental abnormality assessment. Then we form the decision and do a reassessment or reassessment of the response to the treatments. We have to identify the patient's name, age, gender, address, and phone number. That is part of the patient history taken. As we said before, it is a subjective collection of information. Then of the patient history, we do examine the chief complaint and the history of chief complaints, dental history, whether it is a dental routine, episodic care, or symptomatic dental care. Then we do the medical history. We know if the patient has a previous or a prior medical conditions, infections, if the patient has taken immunizations before, or have been admitted to hospital, or even having a certain allergy allergic reaction. Family history is also important to ask the patient if his family is suffering from a communicable and genetic conditions that he could be affected by, and a social history, whether it is on his occupation habits and hobbies. More questions including if the patient's having a specific conditions like thyroid problem, edema, stroke, arthritis, etc. The patient history taking is important as we do this to see if the patient is able to receive the treatment or not. The initial communication between the dentists and the patient should be managed professionally. Rapport is critical to elicit or for eliciting useful information on the patient's own words. That's why rapport is important for the communication and for the patient to give the information after receiving good reports. And medical jargon is recommended to be avoided, even if the patient is a regular patient who can understand some of the dentistry jargons. Usually, best question is an open question, and during the history taking, the mental state of the patient should be assessed. Lastly, you have to know what is the patient expect after the treatment is completed. What is the patient's expectations and gain from the consultation and the treatment. At the beginning, an introduction, introduce yourself, then put the patient at ease, then ask an open question. Mixed open and closed question is okay, but avoid leading question and jargon. Explain the need for using specific questions like, do you brush your teeth regularly, or do you take a certain type of medicine? You have to explain why you ask such questions. Assess the patient's mental health and expectations from the treatment and from the consultation. At the beginning, the patient's identification is beneficial for the clinician in many ways. For the name, obviously, it gives an identification and maintaining of the patient's record and for communication purposes. For the age and sex is important as some diseases has a prevalence to sex and to age. And in order to establish a treatment plan, whether this treatment plan is going to take years or months. The address is also important for the future correspondence, and there is some diseases that is geographically specific to some locations in dentistry and even in oral and medical diseases. The occupation will give a general look on the financial status, diseases prevalence, and an open and the free time to schedule an appointment. Next is the chief complaint, and here is the patient coming from pain of this condition. This is what pushes the patient to seek for visits, consultation, and treatment. Let the patient speak about this in his own words. Onset and course of the chief complaint and duration is important. The chief complaint is why the patient has come to visit in the first place and to seek treatment. Let the patient speak about this in a chronological order and do not interrupt his describing of the chief complaints if he is having pain, discomfort, bleeding, swelling, ulcer, trismus, or malocclusion. History of the chief complaint is also important to record. When was the first time the patient felt the pain and the chief complaint? Specific list of questions to collect information about the chief complaint, including the onset and the duration, site and first sign, relieving factors, and stimulating factors. Also, previous treatments all are specific to the chief complaint questionnaire. The patient history is important also to ask the patient about the frequency of his dental care, if it's a routine, periodic, symptomatic care, and what type of care he has done to his teeth, if it was exo-operative, what his complications and what are the causes of the pain. This all will give us an idea about the regular attendance and attitude toward dental treatment and recent relevant dental problems. What are the recent problems that the patient had and is having? What was the last time he visited the doctor? And the frequency of prophylaxis, whether it was toothbrushing or flossing, and the history of previous dental treatment are all part part of the patient's history or part of the dental patient's history. Now let's move to the medical history. Medical history is important to assess the patient's health condition and status, to better understand the orofacial complaints and diagnostic, to determine the treatment plan, and even to ask the patient's physician of an unknown medical problem or high-risk condition. This all must be printed on a standardized questionnaire to know what is the general health and medical history of the patient. Medical history also include the patient, if the patient is suffering from a medical problem or on regular medication. Medical problems like cardiovascular system problems, chest pain, palpitations, dyspnea, respiratory system problems wheezing, chest pain, cough, and hematoptysis. Hematoptysis meaning coughing of blood. Hemato or hemoptysis. If the patient is suffering from a systemic problem like syncope, nervous system problem, syncope seizures, incurating movement, or gastrointestinal system problems, examples, nausea, dysphagia, change in the appetite, hematemesis meaning puking of blood, indigestion, constipation, diarrhea, and vomiting. Genitourinary system, for example, increased frequency of urination, nocturia, hematuria, more problems like endocrine system problems, polyuria, polyphagia, polydipsia, meaning is increasing times and frequency of urination, increasing thirst, polydipsia, intolerance to heat and cold, pigmentations, weight loss or gain is also sometimes some types of endocrine system medical problems. Psychiatric system problems include mood swing, emotional disturbances. More questions of were you ever hospitalized and why? This is important to ask the patient if he is having or going to have an excisional surgery or even a small type of surgery. Is the patient allergic to any kind of food or medication? And is the patient pregnant? And to mention the trimester if she was, and a nursing mother if the mother is nursing or on contraceptives. Also this is important to ask the patient to add to the medical condition and questionnaire. In the diagnostic interview, we ask the patients few verbal questions, and these have many methods and many types of questions, some of which are open-ended questions with unlimited answers. For example, can you tell me about the surgery last year? This is considered to be an open-ended question. A closed-ended question is like a question having a limited number of answers. When did you last see your doctor? This one is an example. A leading question include asking the patient a previously suggested answer. I think you grind your teeth during sleep is one type of questions. I think you grind your teeth. This is a leading question and should be avoided as much as possible. Contradictions is another type of questions. To give a contradiction or suggest a contradiction in the patient's answers. For example, you said no epilepsy, then why do you take drugs for controlling seizures? There is a contradiction between no seizures and drugs that the patients are taking or is taking for controlling seizure. For example, anticonvulsant drugs. Indirect question is another way of obtaining answers of the patient. For example, have you had any complications during the last treatment? This is considered to be an indirect question to know what happened to the patient during his last dental visits. Moving on to the clinical examination in dentistry. The past thing that we have already discussed, the patient's history was subjective, but this time It's going to be objective clinical examination by assessing the oral and dental health of the patient using primary sense of the dentist. In addition, the tools that are used for diagnostic purposes. These are simple tools that we will discuss later. Common methods of examination in dentistry. These examinations are part of the clinical examinations, and there are many types, including visual inspection examination, directly by vision or indirectly by trans-illumination using a mirror, just like in this picture. Also, there is palpation or percussion to see if there is unidigital or bidigital pain tenderness, to examine the shape and size and the site and extent, mobility and texture of the structure using only palpation. Next, using the probing to determine the carious lesion depth or periodontal lesion, periodontal pocket depth. Next, to test the vitality of the tooth using a thermal test or by drilling. This is can be used with cold, that's called thermal test, or by electrical tests. By smelling the patient's disease, you can know and see if there is a bad smell coming from the patient's mouth and if he complains from that problem. Also, auscultation, or we can call it percussion, used to determine the sound of the patient's structure after percussion. This is usually used, auscultation is not percussion. Auscultation is hearing with a sphygmomanometer, or hearing with using only, not a sphygmomanometer, actually it's called a stethoscope. Stethoscope that is used to examine or to auscultate TMJ sounds and atriovenous malformation. These atriovenous malformations can overlie or be underneath the lesion that we want to examine. Now moving to the physical examination. After we have completed history, that was subjective. After we have completed clinical, that was objective. Now to the physical examination, that one is also objective. General assessment of the patient to see his mental orientation, patient awareness of response to place, time, emotional orientation. If the patient is anxious, alert, fearful, suspicious, or distressed. Habit of the patient's body build. Status of the patient, also important. Stature, that one is the patient's height. Bilateral symmetry, equal size of the body. Gait, the type of walking and the manner of walking. Abnormal movements, the type and uncontrolled body movements. Last is to see the speech and to determine if it's normal, abnormal sign. This one was general assessment of the patients. Also to see the vital signs of the patient. More about physical examination. We have to examine the oral cavity extraorally. That's called extraoral physical examination. We examine it for facial asymmetry, if the face is asymmetric, hydration, color pallor, if it's faint color or not very clear, if it's pallor or pale. Examine extraorally for jaundice, cyanosis. Examine the texture of the face, if there is edema, and examine the integrity. TMJ, the TMJ can be examined and see if there is a limitation or a deviation while opening. Limitation, it can be trismus if it's less than 35 to 50 millimeter. That's the normal range of mouth opening. Auscultation, as we said before, to hear using a stethoscope for clicking or crepitations, and the TMJ to use also palpation to see if there is a pterygus and intra-auricular tenderness, masses, pretragus, meaning after the ear here, and intratragus is enter the ear. That is to use palpation with it to examine the lymph nodes, or if there is a tenderness, masses, swelling, condylar movement, clicking and cryptus, and subluxation if there is a subluxation in the condyle. Muscular muscles are also important to examine for using digital palpation for tenderness, abnormalities, if there was a problem with the masticatory muscles. Salivary glands to see if there is enlargement, dryness in the mouth, and the quantity and the characteristic of the secretions of the saliva. If it was watery saliva or purulent saliva. Purulent meaning there is some discharge or some types of pus in the saliva. How is the saliva? If it is viscous, fluid, watery, etc. Here we can see the intra-auricular examination of the TMJ, the pre-auricular examination of the TMJ. Next, temporalis muscle is another masticatory muscle, have to be examined. Lateral pterygoid, medial pterygoid, and the masseter muscle. All part of the extraoral examination, also to examine for lymph nodes, inspection for swelling, position, palpation of the number and size, surface, margin, and consistency, if there is a mobility, nose obstruction, infection, epistaxis, and shape. And the epistaxis is also have to be examined, and it is well known as an urgent medical condition that needs care and urgent care. It is epistaxis, bleeding from the nostrils. Paranasal cyanosis, also important to examine with percussion of the maxillary and frontal sinuses. And we know very well where is the frontal sinus, where is the ethmoid, and where is the maxillary sinus. Maxillary, ethmoid, frontal. Eye colors, some types of conjunctiva. Conjunctiva is the inflammation of the white area in the eye, has to be examined. If there is inflammation, redness, that could be considered as a conjunctiva. For pallor or icterus, pallor meaning faint color, icterus is jaundice of the eye, there is a yellowish color. Conjunctivitis, visual disturbances, edema, and eye exothalmosis. Exothalmosis is exfoliation of the eye. Ears also are important to be examined for hearing impairment, discharge. Tetanus, also neck, is important to examine for any lymph nodes. Here in this picture we can see many areas like to be examined with palpation. For example, posterior auricle, pre-auricle, epitrochlea, infraorbital, buccal, parotid, and infraauricular, occipital, submandibular, sublingual, and submental, hyoid bone, mastoid process, superior deep cervical lymph nodes, superficial cervical, infra-deep cervical, and posterior cervical, sclene belly omohyoid, and superior belly, sternocleidomastoid muscle, and supraclavicle here above the clavicle. And the clavicle, of course, very well known bone. And in this picture we can see the examination of the cervical lymph nodes. The face asymmetry can be seen here, and for conjunctiva we have to examine the eye for jaundice, conjunctiva, pallor, and this eye looks normal to me. Now moving to the intraoral examination, which is the most important the dental point of view, and a complete visualization with a good source of light should be performed in a systemic regular method, and the examiner must be familiar with the normal appearance and intraoral structures of the normal anatomical variations. Diagnostic set. The dentist has to be seated behind the patient or even standing behind the patient with a 10 to 11 degree, avoiding resting the arm over the patient's shoulder, and avoid keeping instruments on the patient's chest. The dentist also standing on the right side of the patient. Dentist should not keep instruments on the patient's chest, as I said before, standing behind the patient. When it comes to teeth, if we're talking about the upper and lower right side of the dental arch of the patient, the dentist here should stand on the right side of the patient. But if we are talking about the left upper and lower teeth or structures of oral intraoral cavity, the dentist should stand behind the patient. Thank you for listening to this lecture, and there is a similar lecture on examination and clinical diagnostic that is going to be coming soon.